Okay, today I'm going to be talking about genetic cancer risk testing. So, in most of my patients, I'm going through their family history. Maybe there's a few cases of cancer, or they were adopted and don't know their family history, or they're just a person that wants an entirely 100% all out effort in prevention of cancer. And so, for most of my patients, I start to talk to them about genetic cancer risk testing. So it's a blood test, and the blood test looks to see if you have any genes that would predispose you towards certain types of cancers like breast, colon, prostate for men, but other cancers. And it's not just looking at like BRCA1, BRCA2, it's really looking at a lot more genes than that and tiny SNPs, not whole genes, but tinier portions of genes. So it's really looking at a vast spread of what we know as far as which mutations in genes can predispose to cancer risk. So, why might somebody want to get genetic cancer risk testing done? Well, it can change your lifestyle and it can change your screening for that cancer risk and what your insurance pays for screening for that cancer risk. So, let's take breast cancer, for example. Say somebody has certain family members that have had breast cancer, or somebody who's had maybe ovarian or prostate cancer. And so their insurance says, yeah, we'll pay for this. Or say someone really wants just preventative cancer risk work done in their life, and they want to pay for it cash. And it's really not an unreasonable price. It's somewhere between $200 and $300 cash pay typically. And that usually includes some time with a genetic counselor as well as free with part of the genetic testing. And so, say this person takes this blood test, and right now they're just getting mammograms every year. That could change. So, say they have a mutation that increases their risk for breast cancer. If their lifetime and genetic risk puts them at a lifetime risk of greater, if their personal clinical history risk and their genetic risk put them at a more than 20% lifetime risk of breast cancer, then your insurance will likely pay for MRIs and mammograms every year. And why would you want to add an MRI on? Well, it can really decrease false positives that come from mammograms and false negatives. So MRIs with the mammogram can be beneficial and could be paid for if you can show that you have that greater than 20% lifetime risk of breast cancer. So another example is, say a gene comes back and shows higher risk of colon cancer. Well, you might shorten the interval of when you have your colonoscopies, and it will change the way you live your life. If you are at higher risk of colon cancer, you may decrease your alcohol consumption. You may decrease red meat or processed meat consumption because these are known carcinogens that can predispose risk towards colon cancer. So I find genetic cancer risk testing very beneficial. Who might it not be good for? So if you are going to lose sleep at night because you found that you have a mutation that increases your risk for breast cancer, and therefore this is only going to create negative change in your life and not positive change, then yeah, this is not the right test for you. Or if you are somebody who is worried about your life insurance premiums going up based on genetic cancer risk testing, then that could be the other risk. Overall, risk is low, benefits are high. I think it's a very beneficial test to talk to your doctor about. I love the conversation in perimenopause because I think women in perimenopause are really waking up to their health and saying, I'm going to make some changes. I am going to live in a way that's going to give me the best longevity and quality and quantity of life that I can have. So I really see it as a part of perimenopause and menopausal health care.